There has been a trend towards this sort of guideline, protocol-driven medicine, for the last 2, 3 decades, and I think it's only gotten worse. And they've really beaten the art out of the science and art of medicine. It didn't used to be just the science of medicine. There really was an art to it, and that's why experience mattered. Because the experienced physician could really think outside the box, rely on unusual cases they've seen in the past, and all that has been just drained out of medicine. It's really, and especially oncology, I find that it is so guideline and protocol driven. And these guidelines, they're set by the big medical association, the Cancer Society and so on. And what is in the guidelines is really just a sequence of big pharma drugs that they want these doctors to administer in a certain sequence, and that's it. Really, there's no sort of inquiry. There's no, let's look at, the unusual features of this case. Why is it happening? What's the background? Uh, what's the environment? What's the diet? Did the patient exercise or not? What kind of drugs did they take? What kind of vaccines did they take? There's no inquiry whatsoever, no attempt to find out what may have caused the cancer. I think it's mostly assumed that these are, genetic anomalies that arise in cells or mutations, and really the push is just, and a lot of cancer patients tell me this, they just get pushed right away into chemo, surgery, radiation, maybe some really expensive drugs like, immunotherapy treatments, targeted therapy treatments, and that's it. They get pushed immediately into treatment, and just a sequence of treatment that really maximizes money for big pharma. Cancer drugs are by far the biggest moneymaker, and I think it's just become this sort of money profit generation model where the doctors are really just pharma sales reps. I mean, the oncologists and many of them, like you said, they mean well. They do care. There's oncology nurses that really care, but they are in a system. They're really prisoners of a system that makes them pharma sales reps instead of true doctors.